Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Fatigue Severity Scale assesses the impact of fatigue on daily functioning. It measures the severity of fatigue and its effects on motivation, physical activity, and work performance. The scale is commonly used in patients with neurological disorders, such as multiple sclerosis and systemic lupus erythematosus. Its main purpose is to quantify fatigue levels to aid in clinical evaluation and guide treatment decisions. The Fatigue Severity Scale is a reliable tool for monitoring changes in fatigue over time in chronic medical conditions. The Fatigue Severity Scale is indicated primarily for patients experiencing chronic fatigue associated with neurological and autoimmune disorders. It is most commonly used in populations with multiple sclerosis, systemic lupus erythematosus, and stroke. The scale assesses the impact of fatigue on daily functioning, making it particularly useful in clinical contexts where fatigue severity influences treatment decisions and quality of life evaluations. Its application extends to research settings, evaluating fatigue interventions, and monitoring symptom progression over time. The scale demonstrates high reliability and validity across diverse patient groups affected by fatigue-related impairments. The Fatigue Severity Scale consists of 9 items designed to assess the impact of fatigue on daily functioning. Each item is a statement related to fatigue symptoms and their effect on motivation, exercise, physical functioning, and interference with work, family, or social life. Respondents rate their agreement with each statement using a 7-point Likert scale, where 1 indicates strong disagreement and 7 indicates strong agreement. The total score is calculated by averaging the responses across all 9 items, resulting in a score ranging from 1 to 7. Higher scores reflect greater fatigue severity. A score equal to or greater than 4 is generally considered indicative of significant fatigue affecting daily activities. Scores below 4 suggest mild or non-disabling fatigue. Clinicians should interpret results in conjunction with clinical evaluation and consider potential confounding factors such as comorbid conditions or medication effects. The Fatigue Severity Scale demonstrates variable sensitivity and specificity depending on the clinical population and cutoff scores used. Sensitivity refers to the tool's ability to correctly identify patients who truly experience significant fatigue, while specificity indicates its capacity to correctly exclude those without clinically relevant fatigue. For example, in studies involving multiple sclerosis patients, the Fatigue Severity Scale has shown sensitivity values ranging from 0.7 to 0.9, indicating it correctly identifies 70 to 90% of individuals with fatigue. Specificity ranges from 0.6 to 0.8, reflecting correct identification of 60 to 80% of patients without fatigue. These metrics assist clinicians in interpreting fatigue severity scale scores. A high sensitivity reduces the chance of missing fatigued individuals, while adequate specificity minimizes false positives, thereby guiding accurate diagnosis and management. The Fatigue Severity Scale was originally developed in the late 1980s by Krupp and colleagues to quantify the impact of fatigue on daily functioning, particularly in patients with multiple sclerosis and systemic lupus erythematosus. Subsequent validation studies demonstrated its strong internal consistency, with Cronbach's alpha coefficients frequently reported above 0.9, indicating high reliability. Construct validity has been established through significant correlations between Fatigue Severity Scale scores and related measures of physical functioning and mood. Test-retest reliability has been confirmed in various clinical populations, with intra-class correlation coefficients typically exceeding 0.8, suggesting stable measurements over time. Additionally, the scale has shown sensitivity to change in fatigue levels following therapeutic interventions, supporting its utility in both clinical and research settings. Cross-cultural adaptations have further validated its applicability in diverse patient groups, maintaining robust psychometric properties across languages and conditions. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.